Hi, everybody. Good morning, and thank you all so much for being here. Thank you to the AIDS Foundation for hosting us. And I'm pleased to be joined here with a number of our good leaders, including my partner in these initiatives, Supervisor Rafael Mandelman, Dr. Grant Colfax, Dr. Nagusa Bland, as well as our new District Attorney, Susie Loftus, and members of the task force. I just want to thank all the members of the task force who participated in this process. You know, I think Supervisor Mandelman and I had a conversation when he and I talked about this task force and what he wanted to do with it. And he said specifically to me, I don't want to do a task force that does a report that just sits on the shelf. And that's really what I'm excited about, because in implementing this task force this year, we have recommendations that we are not only working to implement, but we're going to see hopefully real results as a result of the amazing work that the task force has done. We know that in San Francisco, we have a serious problem with meth use. And in 2018, over 126 people died of a meth overdose in San Francisco, and the number of overdose deaths from meth rose over 500% in the last 10 years. Meth use is both a public health and a public safety issue in our city. We know that meth is not only provides substance use challenges in San Francisco, but we need to make sure that we have a citywide approach to address the combined challenges of substance use, mental illness, and homelessness in particular. And that's why, along with the Department of Public Health, we announced a comprehensive plan to help those who are most in need of mental health care and substance use treatment, entitled UrgentCareSF. With UrgentCareSF, we include building a new system of care coordination, outreach, and low barrier services and harm reduction designed to meet the specific needs of the 4,000 people who we know are dual diagnosed. Several of the meth task force recommendations are prioritized in UrgentCareSF. In February this year, we convened this meth task force under the leadership of Supervisor Mandelman with 3 goals in mind: to decrease health risks for people under the influence of meth, to identify best practices for treatment and service options, and to reduce the negative medical and social impacts of meth use for all San Franciscans. Over the past 6 months, the task force has met to understand the specific challenges that meth presents for our city and to develop recommendations that would help address this issue. And the report issued today details the findings as well as 17 recommendations. Several of the recommendations go hand in hand with our goals around UrgentCareSF, which include creating a Meth Sobering Center, strengthening our mental health and substance use crisis response, increasing the availability of safe indoor spaces such as drop-in centers, shelters, and navigation centers, expanding case management and wraparound services, and expanding the availability of treatment beds at multiple levels. Some of these recommendations, like meth sobering centers, are new efforts, and we're working to implement those while several build upon work that is already underway. By creating a trauma-informed sobering site for people who are under the influence of meth, we will have a place where people can go or can be taken to, and where staff will be responsibly trained to help them. In addition to creating a safe place for people to sober up, the center will be a place where we can connect those individuals to services. The Department of Public Health is currently exploring locations for this center, and our plan is to have at least one of these centers open within the next 3 to 6 months. We've already taken action on a few of the recommendations that I mentioned earlier. In September, we announced a partnership with Tipping Point Community to open up another 14 Hummingbird psychiatric respite beds. We also announced a plan to expand the hours of the Behavioral Health Access Center to increase the availability of safe indoor spaces and help those who need it get connected to care. We're also making progress on adding another 1,000 beds to our behavioral health treatment system. We've already funded 212 beds in this last year across the continuum of harm reduction, treatment, and recovery services. The issue of meth use also connects with our efforts on expanding conservatorship in San Francisco, because the new conservatorship allows us to extend the benefit of care to treatment to people with mental illness and substance use disorder. We know that among people with at least 850-150 psychiatric holds, nearly 9 in the 10 are users of meth. And as we work to implement a successful conservatorship program, it's important that we understand the overlap between meth use and eligibility for conservatorship. We are making progress, and we know that progress is not moving fast enough, but we need to be responsible in how we coordinate the right system so it actually delivers the results we need to have an impact on what we see out on the streets every single day. It's one of the reasons why I hired the first ever mental health reform director this year, to really analyze the system, to find out what the challenges are, and to work on solutions. There's not one solution that is going to get us to a place where we need, but we see the problems, we understand the challenges, we understand the data, and the data is going to help to inform the decisions that we make so that we can get real results. We are making progress. And one of the recommendations of the task force was to strengthen our mental health and substance use crisis response. Under UrgentCareSF, we're going to add more behavioral health resources to accompany police on calls through our 311 system, so that our police department is working hand in hand with one of our street medicine team workers so that we can, again, provide people with care and get them into one of our sobering centers if necessary. We're going to take action on the recommendations to expand case management and wraparound services, specifically by reducing the patient to provider ratio so that we can really get the kinds of results that we need. Adding staff to handle the additional cases is also critical. And our next steps include taking action on these recommendations. My office will carefully review the other recommendations included in the report and determine which ones will move forward and which ones will be incorporated into the work we are already doing with UrgentCareSF. I want to thank again the members of the task force for dedicating so many hours to this work, this very critical work. The report and set of recommendations will be extremely helpful as we move forward to address meth use that is hurting so many people in this city. I now have the pleasure to introduce the person who has really been leading on this charge. Supervisor Mandelman is the person who came to me about this issue early on to talk about the challenges that existed. He knows that I care about opening safe injection sites, and that has really been a focus of my administration, and I'm really optimistic that we are closer than ever before to getting there. But he really highlighted the fact that we are seeing the number of folks who are dying on our streets with methamphetamine increasing significantly. And so he has been the leader on shining a light on this issue, and I am hopeful that because of his leadership in this work, we can take these recommendations to the next level so that we can see a difference and we can help save lives. So ladies and gentlemen, Supervisor Rafael Mandelman.
Thank you, Madam Mayor. Thank you for your commitment and persistence in making the changes in the city that everyone agrees need to be made, and for your fortitude in making those changes that are necessary but not everyone agrees need to be made. San Francisco has a meth problem. I think we all know it. We all see it on our streets, in our hospital emergency rooms, in our jails, and too often in the growing list of San Franciscans dying from overdoses. Among homeless San Franciscans who have died on our streets, methamphetamine was the most commonly present substance, showing up in 47% of deaths. Now, this is not the first time San Francisco has engaged on the issue of meth and its impacts on our communities. It was nearly 15 years ago that then Mayor Newsom and then Supervisor Dufty convened the city's first meth task force focused on meth's impacts in the queer community. And I know there's some veterans of that effort here in the room, some of them who were part of the impetus for this second meth task force. Hey, Mike Shriver. That task force did important work and helped lead to innovations and models of response that our task force has studied. And I think it's really appropriate that we're here in this San Francisco AIDS Foundation building here at Strut. Hey, Joe Hollandonor, thank you for your work, and thank you for giving us Laura Thomas and Mike DeCepola, who, where's Mike? There's Mike. Laura's back there. Okay, who made such important contributions to this task force, but have been doing amazing work on drug policy and helping folks out for many decades now. Well, a couple of decades. All right, I'll stop before I get in more trouble. All right. This task force and the report we released today is then not really the beginning of a conversation, and it's not certainly the end of the conversation. It can't be, but I do believe we've made important contributions to that conversation. Today, meth addiction is still very much a queer issue in San Francisco, but as we know and as the report documents, it's also a public health crisis that threatens the safety and well-being of vulnerable residents across the city, in every community, and threatens those communities. The report contains 17 recommendations, and we can't go into each and every one of them here. I want to highlight a couple of them in particular. The first recommendation is to create a trauma-informed sobering site with integrated harm reduction services for people who are under the influence of methamphetamine. Drug sobering centers were the task force's top recommendation. Across the spectrum of participants, whether law enforcement, service providers, people with lived experience, everyone agreed that we need places that are not psychiatric emergency services, that are not emergency rooms, and that are not jail for people who are meth intoxicated or in meth-induced psychosis. A safe place for them to be, and a place that by them being there leaves the communities from which they came safer. This is something we must do, and I am so grateful to our mayor, her team, and Dr. Colfax for their commitment to making this happen on an expedited timeline. The second recommendation of the task force, which also, I believe it was the second highest recommended recommendation, was to strengthen the city's interdisciplinary behavioral health crisis response. I hear almost every day from constituents who are seeing folks in distress, folks in psychosis, pretty much every day, and they have no idea what to do, who to call, how to get a response. They 311 it, it doesn't work. They feel nervous about calling the police. And so what the mayor recognizes and what has worked its way into UrgentCareSF and what will be moving forward are other responses so that San Franciscans who are seeing neighbors in distress have a number they can call, an app they can dial, and they can get in real time an appropriate response that isn't necessarily the police. If you need a police officer for that encounter, the police need to be there, but ideally it's not the police. And so that is something that I think will change lives, both for folks who are in crisis and for the communities in which those folks are living. There's a third recommendation that is buried way down there. It's item number 17. It's actually really important, and it is strengthen collaboration among city agencies and service providers. I want to highlight this recommendation because it is the reason Dr. Bland exists. And I again want to thank Mayor Breed for creating this position, for recognizing the need to look across city agencies, to look to our nonprofit partners, to bring folks together, to get out of the silos, and to have us working together towards common destinations and towards getting care to the people who need it. we can do this. I don't want to steal Dr. Colfax's thunder because I think he may say some similar things and I'm going to say it again. We know we can do this because we've done it before. The San Francisco model of HIV care was innovated by a city that had been abandoned by the federal government to deal with really challenging public health crises here at the local level. And although we were angry, and many of the folks here protested the federal government's inaction, in the Department of Public Health, in other city agencies, and in our nonprofit partners, we innovated and we created a San Francisco model of care that has now resulted in new HIV infections dropping below 200 for the first time. That is amazing. We're going to get to zero, but the fact that we were able to do it there gives me hope that we can do it here with our behavioral health services, and Dr. Bland is going to get us there. Thank you again, Mayor Breed, for all of your work in all of these behavioral health issues. It can't be done in a day, but you have not rested a day since you have started. And I am grateful for that. I want to thank my co-chair, Director Colfax. I want to thank the DPH staff who worked so hard on running these meetings, and then on the report, I want to thank Aaron Mundy in my office for all of your work. And of course, I want to extend my profound thanks to all of the task force members who do such extraordinary work in your work lives, who go above and beyond every day, but who gave us the wisdom, the expertise, the experience to come up with a report that I think really does, as I said, make a useful contribution to the conversation. So I'm excited. Thank you.
Thank you, Supervisor Mandelman. I also want to take the opportunity to thank and recognize Commander Raj Vaswani, who is joining us here from the police department, as well as Brent Andrews from PRC, some amazing community partners. And we have two more speakers, and at this time, I'd like to ask Dr. Grant Colfax, the Director of the Department of Public Health, to say a few words.
Well, thank you, Mayor. And I think actually before I started, you announced that I was going to be co-chairing this task force. So I'm really pleased, and it's great to be here with so many colleagues and friends. And having worked on this issue for several decades, I think this is an amazing day as we move forward with recommendations. And the health department, with so many partners in the room, we do big things. And this is one of the next big things that we are going to do. I want to thank Mayor Breed for her leadership in this, my co-chair, Supervisor Mandelman, and all of the members of the task force, including, of course, Dr. Ngozi Bland, and the public health team that really helped move this forward. And I think very importantly, the people who are living or in recovery with meth addiction, because I think that their voices in the room, the courage they showed in coming forward and sharing what needs to be done and helping us come up with solutions is really, really key to our moving forward. I'm committed to ensuring that the recommendations of this report are implemented. We did that with HIV, we'll do it with this. We can get this done. And I also think it's important that while we think of meth as obviously a substance addiction and very having very concerning health consequences as a result of that, including overdose, we also have to frame this in the broader context of health and wellness. Meth has effects on strokes, it has effects on cardiovascular health. We know the documentation on HIV. So providing a broader contextualized approach to how we address people who are using meth, meet their needs, and people who are at risk for meth is really key. This is an evidence-based, community-informed report that will save lives. That will save lives. And I think sometimes when we issue these reports, it's really important to remind ourselves of that. It will save lives as we implement. It will also improve the quality of life for all San Franciscans. We are all affected by the meth epidemic, and today we're coming together to do something about it. And I think one of the key things that stood out in the task force is that San Francisco is a city of compassion, right? And we are driven by the conviction that all individuals deserve an opportunity to achieve their health and wellness goals. We've courageously demonstrated leadership on so many fronts. I said we do big things, from our approach to HIV, to implementing Healthy San Francisco, to implementing the Affordable Care Act, our approach to hepatitis C. We can do this. We can do this going forward. We know that lives are being lost to meth today, and that people struggle with this destructive substance that causes harm, emergencies, and disruption to our city. So the urgency to get this done is really key, and I'm so pleased that we are working furiously to figure out where the Meth Sobering Centers can go so we can start saving lives as soon as possible. About half the people who come to the psychiatric emergency services at Zuckerberg San Francisco General Hospital have a meth-related problem. Half of them come voluntarily seeking help. Places like the new Meth Sobering Center will begin to provide them some relief and will free up valuable space and resources to treat more people in our city's emergency rooms. We can make changes to our system that will make a difference. We've operated a sobering center mainly for people who use alcohol since 2003, and we will build on what we've learned from that to implement this sobering center and others. As the task force has met over these past 6 months, we have heard stories of hope, learned about promising treatments, and dug into the data that tell us the extent of the problem. We will continue to do the work, join with the community and all of you to improve San Francisco and to take on this danger to our families, friends, and neighbors. Together, we can and will make a difference. Thank you.
Thank you. Now, a few words from Mike DiCipolla from the San Francisco AIDS Foundation.
Thank you, Mayor Breed. Thank you very much. I'm a little bit nervous. I'm going to read my statement here, but I actually just want to comment. I agree with Grant that the city of San Francisco has been courageous. I am very passionate about the work that we do at the Stonewall Project. I've been working with meth users for over 15 years. So I'm a member of the task force, and I was a member of the last task force years ago. I'm Senior Director of Behavioral Health at the San Francisco AIDS Foundation. And I'm the director of one of the city's first outpatient substance use treatment and counseling programs, the Stonewall Project, that is firmly rooted in the Department of Public Health's policy of harm reduction-based service delivery. Our substance use program, the Stonewall Project, was funded in 1997 by was founded in 1997 by Michael Seaver, and serves gay, bi, and trans men who have sex with men, and for some services, trans women who want assistance with substance use concerns, including challenges with the use of crystal methamphetamine. Our program was founded as one of the first programs and as a result of the first treatment on demand recommendations over 20 years ago. Our program allows participants to enter at all levels of substance use, misuse, and/or dependence. For our first 10 years, the Stonewall Project focused our work exclusively on substance use services and treatment solely within the intersections of meth use and HIV transmission and infection. At its inception, our program was seen as radically different than the care offered at most substance use counseling and treatment programs due to our harm reduction approach. Thanks in large part to the funding from the San Francisco Department of Public Health and the San Francisco AIDS Foundation's many generous donors and other funders, we remain strong and have expanded our substance use services, including our low barrier and free harm reduction services offered through our innovative Harm Reduction Center on 6th Street in San Francisco's Soma District and at our other service locations in the Castro and the Tenderloin. We recently started our Prop for All program to offer our evidence-based contingency management and other programming that serves meth users beyond our services for gay, bi, and trans populations to non-gay identified meth and other stimulant users. As is called out in the Methamphetamine Task Force recommendations, the San Francisco AIDS Foundation has been working to expand all easy access services. We have been expanding our programs in partnership with our other behavioral health efforts and other treatment and support providers throughout the city. We offer low barrier overdose prevention and substance use counseling and support to injection and non-injection drug users in the streets and through our drop-in harm reduction center and other services. I'm proud of the release of these recommendations that in large part recognize what our vision has known all along. At the San Francisco AIDS Foundation, our substance use programs respect all methods to get help with meth concerns and other substance use concerns. We will continue to dig deep and innovate along with the city and other departments to effectively offer offer the type of low barrier and other support and treatment services and outreach recommended for enhancement and expansion under the task force recommendations. At the San Francisco AIDS Foundation, we love drug and alcohol users, including meth users. We value community ideals that offer compassion and dignity to our lovers, families, friends, community members who use, misuse, and/or who struggle with substance use dependence. I'm honored to be here today to support the Methamphetamine Task Force evidence-based recommendations. I congratulate my fellow task force members and want to especially thank Mayor Breed, the Department of Public Health's Director, Grant Colfax, who served as co-chair, as you've heard, and the task force other co-chair and board of supervisor for District 8 member Supervisor Rafael Mandelman. I applaud Mayor Breed and Supervisor Mandelman for their work with the city officials and DPH staff to assemble and support a task force. This task force was charged in large part to evaluate and recommend ways to improve our system of care for substance users, including substance users on our streets. The San Francisco AIDS Foundation and our CEO, Joe Hollendonner, looks forward to partnering with the city to realize the vision set forth in the Methamphetamine Task Force recommendations. I believe that when we accept drug users without stigma or shame and welcome them high, low, crashing, and in all states of health, mental health, and substance use and misuse, we have nothing to gain but vast improvements in serving all residents with substance use concerns to improve their health and functioning. Low barrier services like those recommended today offer particular improvements for community members not ready for more intensive or traditional treatment options through easy access service options, support drop-in centers, case management, more accessible substance treatment, and supportive policy on all levels of healthcare delivery. Thank you, and please join with us to support the recommendations put forth today.
Thank you, Mike. And another great partner in this effort who will say a few words, Brent Andrews with PRC.
It's wonderful to be here. I'm just looking down the line here. Thank you for allowing me to be a part of the analysis and process as we move forward. Susie, you and I are friends of decade plus. You're my mayor, and I support you fiercely, stand right beside you in all the work that we're getting ready to do. We've known each other for years, and thank you for your leadership. You and I have to find a new place for dinner because Fintown is closed. And of course, I know Mike for years, and Commander, you're a new friend of mine. So it's just really lovely to be here. When the mayor was speaking, all I could think was, see, don't say that because that's in my speech. Wait, don't say that because that's in my speech. So you're just going to hear it one more time. You notice I'm up to 18-point font because I'm 55. First, I do want to thank the mayor and Supervisor Rafael Mandelman for understanding the importance of convening the Methamphetamine Task Force. As we seek to address the critical issues of the day, homelessness, mental health, and substance use issues, we could not have achieved that successfully if we didn't fully address the growing crisis of meth and its effects that it is having on our community. Over the past 8 months, the task force came together with a shared goal of seeking to decrease health risks, identify best practices, and reduce the negative and medical and social impacts that meth is having on San Francisco. Among the 17 recommendations, the creation of the Trauma-Informed Meth Sobering Center is key among them. Rather than being an opportunity to take someone to the psychiatric emergency services, the Sobering Center would provide an appropriate alternative, giving them access to outpatient services and other community-based mental health and substance use treatment services. PRC understands the value of an effective and innovative program. As many of you know, in partnership with the city, thank you, Mayor, we are in partnership with the city on Hummingbird Place. It is a low-threshold barrier removal navigation center located on the campus of Zuckerberg General. This innovative program addresses the cross-section of substance use, mental health, and homelessness, with many people transitioning into one of our 9 residential treatment sites. Sometimes they have been there only for their very first time. They've been on the street this long. They've made the decision for themselves. This home-like environment when someone is off the street and feeling safe and supported with 3 meals a day and shower facilities and a home-like environment and a beautiful outside, I love that, I call it nature therapy. When you're able to be off the street and out of duress and finally make that decision for yourself, that you want to show up for yourself and live a life of dignity, I know that we can do that. 1 out of every 4 individuals that comes through Hummingbird goes into treatment. These programs are effective. It is clear when we come together with our shared values leading the way, there is nothing that we cannot achieve. I'm pleased to be a part of the process and look forward to partnering with the city in the implementation of many of these recommendations from the task force. Again, I want to thank the mayor, Supervisor Mandelman, Dr. Grant Colfax. I'm looking forward to partnering with you. I want to acknowledge the many nonprofits that are in the room and across this community. It is because of all of you we are able to provide a beautiful network of client-centered and robust system of care. Thank you.
Thank you. And last but not least, I'd like to just say this is not a new challenge for our city. When we think about even going back as far as the 1960s, heroin epidemic, into the 70s and the 80s with the crack epidemic and all of the drugs, sadly, that have really destroyed lives and destroyed communities and destroyed families, we know that we can't just turn a blind eye because we don't like it or because we don't want to see it. We have to think about ways in which we can make sure that providing help, providing support is integrated into what we do in our medical system. It has to be something that is accessible to all people and not just those who can afford treatment. I have been out in the community on a regular basis, and when I talked about safe injection sites, you know, it's interesting that whether it's a wealthy neighborhood, in between, or poor neighborhood, I always have someone who walks up to me and tells me about their child, about their friend, about their family member struggling with an addiction. None of us is immune to the struggle of, it could be any one of us, it could be any one of our family member or friends. And I do think it's important that we have better access to treatment on demand, that we have better access to supportive wraparound services. And you know what? They may not accept it on the first, second, or third time, but we have to make sure that regardless, it is available, it is accessible, it is easy to get to. And that is why we need to start looking at how we provide services for those struggling with substance use, for those who sadly are struggling with mental illness. We need to look at a new way of doing things so that it is naturally integrated into our medical system in a more comprehensive, responsible way that has a tremendous impact on people's lives. That is the goal of what we are trying to accomplish, using data, using medical experts, using nonprofit organizations, working together with the city to provide something that will effectively deliver so that we can see a difference and we can save lives. That is the ultimate goal, and I want to thank each and every one of you for your work on the task force and all that you do to help us advance the goals of what we need to do to make San Francisco a better city for each and every one of us. Thank you all so much.